Numerous schools and universities across the United States have already begun their classes, either in person or partially in-person instructions.
And as the school bell rings, there are concerns from parents as to what happens when and if a student contracts COVID-19. KCAU-9 News reporter Marina Bach spoke with a local doctor today to learn what steps families need to be aware of. That's our top story tonight at 10.
Tim and Sophie, one study found that there have already been a 90% increase in the number of COVID-19 cases among children across the U.S. in just the last 4 weeks. Dr. Larry Volz, Chief Medical Officer at Mercy One Siouxland Medical Center, says families should have a plan in place if and when the virus enters your home.
Fever, cough, runny nose, muscle aches, loss of taste and smell.
If your child is experiencing one of these symptoms, Bolt says it's time to contact your doctor.
While you're waiting to get your test back, you have to assume that you are infected. So you really need to try and quarantine yourself. You shouldn't be leaving the house. You need to really try and isolate within the house as much as possible if you can.
Mother of 3, Mindy Larson, knows firsthand what it's like to experience a potential case.
We actually had a close call with a fever and a cough and a sore throat, and we had to get a test done on one of the girls, so we've actually been through it before. It turned out negative, thank goodness.
Although it wasn't COVID-19, she says isolation was key to helping prevent the spread of the illness to other family members.
They would be quarantined basically in their bedrooms, and they have their own bathrooms, and I would just bring food in. They would wear a mask, I would wear a mask.
If your child does contact COVID-19, Siouxland District Health Department is encouraging parents to relay that information to their child's school district.
Then we will work with the school to try to make sure that the person who's positive is isolating at home and is not at school and that kind of a thing. But then we'll also work with them to try to identify those kids and other folks that would have been in close contact with them.
Experts say if there is a chance your child is sick, it's best to keep them home and to immediately contact your doctor.
Just giving them Tylenol 2 hours before school so they show up and don't have a fever really is pretty irresponsible. And you're putting all the entire school and all their classmates at risk by sending them back prematurely when they really could be infected.